The nearest hospital to my cabin is 87 miles away. The nearest pharmacy is 74 miles. The nearest doctor's office is in a town I visit maybe 3 times a year for flour and salt. I have lived on this ridge in the Bitterroot Mountains of Montana for 21 years. In that time, I have dealt with a broken finger, a deep gash on my left forearm that went down to the bone, 2 infected wounds, a tooth abscess that swelled the left side of my face to twice its normal size, first and second degree burns on both hands, a case of pneumonia that kept me in bed for 9 days, intestinal parasites from undercooked rabbit, frostbite on 3 toes, a dislocated shoulder, and more cuts, scrapes, sprains, and bruises than I could count if I tried. I treated every single one of them myself. I did not call anyone. I did not drive to a hospital. I did not take a single pill manufactured by any pharmaceutical company. Everything I used to treat every injury and every illness for the last 21 years grew within 100 yards of my cabin. I'm going to walk you through exactly what those plants are, exactly how I use them, and exactly why the pharmaceutical industry spent the better part of the 20th century making sure you would never learn what I am about to tell you. Stay until the end because the last plant I am going to describe is one that was actively removed from the American medical curriculum in 1949 under circumstances that, once you hear them, will change how you think about every bottle of pills in your medicine cabinet. Let me start with the one I use most because it is the one that saves lives, and it is growing right now within 50 feet of wherever you are if you live anywhere in the Northern Hemisphere. Yarrow, Achillea millefolium. It grows in every meadow, every roadside, every disturbed patch of soil from sea level to 10,000 feet across North America, Europe, and Northern Asia. It has feathery leaves and flat clusters of small white flowers. You have walked past it 1,000 times without knowing what it was. The reason it is named Achillea is because Greek soldiers in the Trojan War packed their wounds with it. That is not mythology. That is the earliest recorded use of a hemostatic plant in Western medicine, and it has been confirmed by modern pharmacology. Yarrow contains a compound called achillene, which promotes blood clotting. It also contains flavonoids and sesquiterpene lactones that are anti-inflammatory and antimicrobial. When I cut my forearm on a piece of jagged metal in my 3rd year on this ridge, the wound was deep enough that I could see the white of the fascia over the muscle. In a city that is an emergency room visit. Up here, it is a Tuesday. I grabbed a handful of yarrow leaves from the patch that grows next to my wood pile, crushed them between my palms until the juice ran green, and packed them directly into the wound. I wrapped it with a strip of clean cloth and held pressure for about 15 minutes. The bleeding stopped completely. I changed the yarrow poultice twice a day for 5 days. The wound closed without stitches. It healed without infection. The scar on my left forearm is the only evidence it ever happened. No doctor, no stitches, no antibiotics, no bill. A peer-reviewed study published in the journal Phytotherapy Research in 2011 tested yarrow extract against standard wound care protocols and found that yarrow significantly accelerated wound closure time and reduced bacterial colonization at the wound site compared to untreated controls. The researchers noted that the antimicrobial properties were effective against Staphylococcus aureus, the bacterium responsible for the majority of wound infections in clinical settings. Staph, the thing hospitals spend billions trying to control with antibiotics that are losing effectiveness every year. Yarrow handles it in a meadow for free. The second plant in my system is one that grows so abundantly on this ridge that I could not eradicate it if I tried. Plantain, not the banana, Plantago major, the broad-leafed weed that grows in every lawn, every trail edge, every crack, and every sidewalk in America. Most people spray it with herbicide because they think it is an eyesore. What they are spraying is one of the most effective anti-inflammatory and drawing agents in the plant kingdom. Plantain contains a compound called aucubin that has been demonstrated in multiple studies to have significant anti-inflammatory and antibacterial properties. A study published in the Journal of Ethnopharmacology in 2013 confirmed that Plantago major extract showed strong activity against both gram-positive and gram-negative bacteria. But the property I use most is its ability to draw. When you crush a plantain leaf and apply it to a bee sting, a spider bite, a splinter, or an infected wound, it pulls material out of the tissue. Venom, pus, foreign bodies. It draws them to the surface. This is not folk belief. This is osmotic action combined with the astringent properties of the plant's tannins. I have used plantain poultices on 2 infected wounds in 21 years. The first was a puncture in my palm from a rusty nail that I did not clean well enough. Within 2 days, the area was red, swollen, hot to the touch, and beginning to streak. That streaking is the sign that the infection is moving into the lymphatic system. In a hospital, they would have put me on intravenous antibiotics immediately. I did not have that option. I crushed fresh plantain leaves, mixed them with a small amount of yarrow for its antimicrobial properties, and packed the poultice over the wound. I changed it every 4 hours. Within 12 hours, the streaking had stopped advancing. Within 24 hours, the swelling was visibly reduced. Within 72 hours, the puncture had drained. The redness was gone, and the wound was closing cleanly. 3 days. No antibiotics. I want to be clear about something here because I am not a reckless man and I am not telling you to ignore serious medical emergencies. If I had been within driving distance of a hospital when that infection was streaking, I would have gone. Sepsis kills. I am telling you what I did because I had no other option, and it worked. And it worked because these plants contain compounds that do exactly what pharmaceutical antibiotics do. They kill bacteria. Except they have been doing it for 400 million years longer than any laboratory, and the bacteria have not developed resistance to them because the chemical complexity of a whole plant extract is orders of magnitude greater than a single isolated synthetic molecule. A bacterium can develop resistance to one compound. It cannot simultaneously develop resistance to 47 compounds working together, which is what a whole plant extract delivers. This is why herbal medicine worked for 10,000 years, and why antibiotic resistance is now one of the greatest threats to modern medicine. The pharmaceutical approach of isolating single compounds was always going to create this problem. The plants never had this problem because they never worked that way. The third plant is the one I use for pain, white willow, Salix alba. It grows along every creek and river in the northern hemisphere. The bark contains salicin, which is the direct chemical precursor to aspirin. When you take an aspirin, your body converts the acetylsalicylic acid into salicylic acid, which is the active pain reliever. When you chew white willow bark, you are ingesting salicin directly, which your body converts into the same salicylic acid through the same metabolic pathway. The result is identical. The pain relief is identical. The anti-inflammatory effect is identical. The difference is that aspirin was patented by Bayer in 1899 and sold for profit. White willow bark has been growing along creeks for free for millions of years. I keep a supply of dried white willow bark in a jar in my cabin at all times. When I dislocated my shoulder pulling a log uphill in my 7th year on this ridge, the pain was severe enough that I nearly blacked out. I reduced the dislocation myself by lying on my stomach on the edge of my sleeping platform and letting my arm hang with a heavy stone tied to my wrist for about 40 minutes until the joint slid back into the socket. Then I chewed a thumb-sized piece of white willow bark and swallowed the pulp. Within 30 minutes, the pain had dropped from unbearable to manageable. I continued chewing bark every 4 to 6 hours for the next 3 days. By day 4, I had full range of motion, and the swelling was almost gone. No ibuprofen, no prescription painkillers, no doctor's visit, no bill. A meta-analysis published in the American Journal of Medicine in 2015 reviewed 14 clinical trials involving white willow bark extract and concluded that it was as effective as conventional NSAIDs for the treatment of lower back pain, with fewer gastrointestinal side effects. Fewer side effects. The natural version that grows by every creek in America is not just as effective as the pharmaceutical version, it is gentler on your body, and it costs nothing. Now let me talk about infection internally, because external wounds are one thing, but what happens when the threat is inside your body is where most people believe they have no option other than a doctor and a prescription. In my 9th year on this ridge, I developed pneumonia. I know it was pneumonia because I have had it before, years earlier in Pittsburgh, and I recognize the symptoms: the deep, wet cough that produces rust-colored sputum, the chest pain when breathing, the fever that climbs and does not break. The exhaustion so complete that walking to the door of my cabin felt like climbing a mountain. I was in serious trouble. I was alone. It was February. The logging road was snowed in. Even if I had wanted to get to a hospital, I could not have driven out. I treated it with 2 plants. The first was usnea, which most people call old man's beard. It is not a plant technically. It is a lichen, a symbiotic organism made of fungus and algae that hangs from tree branches throughout the forests of the Pacific Northwest and Northern Rockies. It is everywhere up here. Every dead branch, every north-facing trunk, draped in pale green-gray threads of usnea. The reason usnea matters is that it contains usnic acid, one of the most potent natural antibiotics ever identified. Usnic acid has been shown in laboratory studies to be effective against gram-positive bacteria, including Streptococcus pneumoniae, which is the primary bacterial cause of community-acquired pneumonia. A study published in the journal Antimicrobial Agents and Chemotherapy tested usnic acid against 12 strains of antibiotic-resistant bacteria and found significant inhibitory activity against all 12, including strains that had developed resistance to vancomycin, the antibiotic of last resort in hospital settings. I made a strong tea from usnea by simmering a large handful of it in water for about 30 minutes. I drank a cup of that tea every 3 to 4 hours for 9 days. I combined it with a second plant, Osha root, Ligusticum porteri. Osha grows at high elevation in the Rocky Mountains and has been used by Native American communities for respiratory infections for centuries. The Zuni, the Apache, the Navajo, all of them used Osha root for coughs, colds, and lung infections. The root contains Z-ligustolide and other phthalides that have been shown to have bronchodilatory effects, meaning they open the airways, and antimicrobial properties specific to respiratory pathogens. I chewed pieces of dried Osha root throughout the day between cups of usnea tea. The combination addressed the infection with the usnea and kept my airways open with the Osha. My fever broke on day 5. The cough began producing clear sputum instead of rust-colored by day 7. By day 9, I was on my feet, weak but functional, and the infection was gone. I have no lab results to prove it was bacterial pneumonia rather than viral. I have no chest X-ray to confirm the diagnosis. What I have is the lived experience of a disease I recognized, treated with 2 organisms that grow within walking distance of my cabin, and recovered from completely without medical intervention. I am not telling you to treat pneumonia with lichen. I am telling you what I did when I had no other choice, and it worked. Now here is where I need to tell you something about the history of medicine in this country that most people have never heard, because everything I have just described, yarrow for wounds, plantain for infection, white willow for pain, usnea for respiratory illness, none of this is fringe knowledge. None of it is alternative. None of it is new age. All of it was standard American medicine less than 100 years ago. Every single one of these plants appeared in the United States Pharmacopoeia, the official compendium of approved medicines in this country, well into the 20th century. White willow bark was in the Pharmacopoeia from 1820 until it was removed in 1926, 2 years after Bayer's patent on synthetic aspirin was finally generating the revenue they wanted. Yarrow was listed as an official medicine until 1936, plantain until 1940. Usnea preparations were referenced in pharmaceutical literature into the 1940s before being quietly dropped from mainstream medical education. The question is why? Why were plants that had been used successfully for thousands of years and that were validated by the official pharmacological standards of the United States government removed from medical practice within a single generation? The answer has a name and a date: Abraham Flexner. 1910, Golden Seal was in the United States Pharmacopoeia from 1831 to 1926. It was reintroduced as an official medicine in 1936 after an outcry from practitioners who still relied on it. Then in 1949, it was removed for the final time. The stated reason was insufficient evidence of efficacy. That claim was made by a review committee that included representatives from 3 pharmaceutical companies that were actively marketing synthetic antibiotics. Penicillin had been commercialized in 1945, streptomycin in 1946, chloramphenicol in 1948. The antibiotic revolution was generating billions of dollars in revenue for companies that had everything to lose if doctors continued prescribing a root that patients could grow in their gardens. Golden Seal was not removed because it did not work. It was removed because it worked too well and it could not be patented. I grow Golden Seal in a shaded patch behind my cabin. It took me 3 years to establish it from root cuttings I traded for with a woman in the valley who grows medicinal plants. It is a slow-growing plant, and it does not tolerate disturbance. But once established, it comes back year after year. I harvest a small amount of root each fall, dry it, and powder it. I use it for intestinal infections, mouth infections, eye infections, and as a general immune stimulant during the winter months when my body is under the most stress. The berberine in the root is effective against Giardia, which I contracted once from undercooked rabbit. I took Golden Seal powder in tea 3 times a day for 10 days. The symptoms resolved completely. A prescription course of metronidazole, the standard pharmaceutical treatment for Giardia, costs $45 and comes with side effects including nausea, metallic taste, and potential neurotoxicity. My Golden Seal costs nothing, grows itself, and has been used for intestinal parasites by the Cherokee, the Iroquois, and the Shawnee for centuries, before a committee of pharmaceutical executives decided it did not work. I want to lay out what my medicine cabinet actually looks like, so you understand the scope of what I am telling you. Dried yarrow leaves and flowers for wound care and bleeding. Fresh plantain for poultices, stings, bites, and drawing infections. Dried white willow bark for pain and inflammation. Dried usnea for respiratory infections and immune support. Golden Seal root powder for intestinal and bacterial infections. Dried osha root for respiratory illness and cough. Cottonwood bud oil, which I make by infusing cottonwood buds in rendered animal fat for joint pain, muscle soreness, and chest rubs. Devil's Club root bark, a plant native to the Pacific Northwest that grows in the valleys below my ridge, for blood sugar regulation and immune support. Dried peppermint and wild ginger for digestive problems, nausea, and stomach cramps. Pine needle tea for vitamin C during winter months when fresh greens are unavailable. I am not anti-medicine. I am not anti-science. The pharmaceutical industry has produced drugs that save lives in acute emergencies, in trauma care, in surgical settings. If I were shot, I would want a surgeon and morphine, not a yarrow poultice. But the vast majority of the $603 billion is not spent on emergency medicine. It is spent on chronic conditions, daily medications, recurring prescriptions, maintenance drugs that manage symptoms without addressing causes. Pain, inflammation, infection, digestive dysfunction, blood sugar imbalance. These are the conditions that plants have treated effectively for 10,000 years, and that the pharmaceutical industry has repackaged into patentable synthetics that cost you money every single month for the rest of your life. I have not paid for medicine in 21 years. I have not taken a pharmaceutical drug in 21 years. I am 58 years old. My blood pressure is normal. My blood sugar is normal. My resting heart rate is 58 beats per minute. My joints work. My lungs are clear. My teeth are intact except for one molar I pulled myself in 2014 with a pair of hand-forged tongs and a shot of homemade birch bark whiskey for the pain. I eat wild game, wild plants, fermented foods, and sourdough bread. I drink spring water. I breathe mountain air. And I treat every ailment with plants that grow within 100 yards of where I sleep. The forest is not a pharmacy. It is better than a pharmacy. A pharmacy sells you a product that someone else made from materials you cannot access, using knowledge you were never taught, at a price you have no power to negotiate, for a condition that in many cases was caused or worsened by the processed food, contaminated water, and sedentary lifestyle that the same economic system sold you in the first place. The forest gives you the medicine for free. It grows it back every year. It does not require a prescription, an insurance card, or a 45-minute wait in a fluorescent-lit room to access it. It asks nothing of you except that you learn what is growing there and how to use it. That knowledge was common 100 years ago. Every grandmother in Appalachia knew yarrow. Every midwife in New England knew blue cohosh. Every rancher in Montana knew OSHA root. It was not specialized knowledge. It was basic survival literacy that every human being possessed before a school teacher from Louisville with no medical training and a check from John D. Rockefeller decided that the only legitimate medicine was the kind that came in a bottle with a price tag on it. Tell me in the comments what your pharmacy bill is every month. Not what your insurance covers, what you actually pay out of pocket. And then ask yourself one question. How much of that bill is for something that grows in the ground for free? Because the answer to that question is the reason this video exists and the reason the next one is going to go even further. The next video is about something I have never talked about publicly. What happens to your body after 21 years of eating wild food, drinking untreated spring water, and breathing air that has never passed through a ventilation system? A doctor tested my blood last year. When he saw the results, he told me they did not make sense for a man my age. I am going to show you exactly what those results were and explain exactly why they terrified him.